Mr. Speaker, more than 28 million seniors get health care through Medicare Advantage, including 600,000 in Washington state. For these seniors and the physicians that care for them, we must deliver a quality product that allows providers to keep our seniors as healthy as possible while reducing wait times, paperwork, and hassle. Unfortunately, the cumbersome and antiquated prior authorization process that many Medicare Advantage plans utilize often gets in the way. This involves multiple phone calls and faxing documents to insurance companies. It's 2022, and even Congress has moved beyond faxing. The HHS Inspector General recently reported that prior authorization is responsible for delaying and even denying medically necessary care. That mirrors reports that we've heard from providers for years now. In one case, the Inspector General found that due to prior authorization, a 76-year-old Medicare beneficiary with post-polio syndrome was denied a request for a walker. In another case, a Washington state resident and professional fisherman had to miss this past summer's fishing season in Alaska because his hip surgery was delayed for months. According to the American Medical Association, 1 out of every 4 physicians report that prior authorization has led to a patient being hospitalized. Prior authorization is also a burden on providers who spend 13 hours a week completing prior authorization paperwork, often for procedures that are approved over 95% of the time. That's time they could be spending with patients. Today, the House of Representatives will take a major step forward in resolving this problem. The Improving Seniors' Timely Access to Care Act will make common sense changes to prior authorization to ensure our seniors are getting the care they need when they need it. First, the bill will require all plans to use an electronic prior authorization system. That means no more phone calls, no more faxes, and no more wondering what information is needed to submit to insurance plans when requesting prior authorization. Second, we establish a process for real-time decision-making. It doesn't make sense that services in line with standard clinical practice guidelines or services that are approved more than 95% of the time are subject to prior authorization. We also know that delayed approvals can result in patients falling through the cracks and missing out on care. Real-time decisions will help stop that. And finally, this bill requires reporting on the number of prior authorization requests, the rates of approvals and denials, and the rates of successful appeals to increase transparency. Collectively, this bill will help providers spend more time with patients and less time with paperwork. Today's vote and the teamwork that brought this legislation to this moment is a bipartisan success story and shows that Congress can come together and put the needs of the American people before the gridlock that we all know too well. I want to especially thank Representative Mike Kelly, our Republican lead, for his tireless work on this for years. Also, our co-leads, Doctors Ami Bera and Larry Bouchon, as well as Senator Roger Marshall, who worked with us when he was in the House in the 116th Congress and has continued this effort in the Senate. I'd also like to thank the over 300 of my colleagues on both sides of the aisle who've co-sponsored this bill. The support for this legislation has been overwhelming, and it has been endorsed by over 500 healthcare organizations. I want to particularly thank the Regulatory Relief Coalition and the American Medical Association that helped develop a quality bill and build support for it. Mr. Speaker, I'd like to submit for the record the list of the endorsements and letters of support from the Regulatory Relief Coalition and the American Medical Association.
Without objection.
I'd also like to thank the staff from personal offices, from the committee and leadership offices that have spent countless hours researching this issue and working with stakeholders to develop this legislation. In particular, I want to thank my former legislative director, Kyle Hill, who is truly integral in developing and advancing this legislation. I urge all of my colleagues to support this legislation, and I reserve the balance of my time.